You know, one of the most important things to be aware of once you've been diagnosed with fibromyalgia is the fact that this condition is not strictly limited to just the widespread pain and fatigue. There are a number of other symptoms associated with this condition. Brain fog and fatigue are very commonly overlooked as just normal for your age or situation. Now, this symptom can range from mild to incapacitating. The fatigue has been described as brain fatigue. Patients feel totally drained of energy. Many patients say that they feel as though their arms and legs are tied to concrete blocks and they have difficulty breathing, i.e. brain fog. Fibromyalgia is a complex chronic disorder which causes widespread pain and fatigue, usually accompanied by a variety of other symptoms. Few of these symptoms are outwardly visible, however, which has led to much confusion. Sometimes fibromyalgia has been called the invisible disability. Fibromyalgia pain usually consists of diffuse aching or burning described as head to toe. I know personally that many times patients could only explain and describe their pain as a feeling as if their entire body was on fire. Not like a sunburn or a surface irritation, but a deep down in the muscles, bones and joints type of burning. It is very important to be as descriptive as possible when discussing your pains and symptoms with your doctor. Doing this can help the physician to better determine your condition and possibly uncover any hidden serious illnesses that may have been brushed off as fibromyalgia. It's important to note that these fibromyalgia symptoms will and do vary in intensity and duration from person to person. As a result, the effect of fibromyalgia symptoms on your quality of life is also different than that of someone else who is suffering from the same condition. There are a number of other symptoms that may be associated with fibromyalgia, such as stiffness. Body stiffness may be particularly apparent upon awakening and after prolonged periods of sitting or standing in one position, or coincide with changes in temperature or relative humidity. Increased headaches or facial pain. Fibromyalgia patients may experience frequent migraine, tension, or vascular headaches. Pain may also consist of referred pain to the temporal area or even behind the eyes. Approximately 1/3 of patients with fibromyalgia are thought to have pain and dysfunction of the temporal mandibular joint, or TMJ, located where the jaw meets the ear, which produces not only headaches, but also jaw and facial pain. Of course, there are sleep disturbances. Despite sufficient amounts of sleep, fibromyalgia patients may awaken feeling non-refreshed, as if they have barely slept at all. Alternatively, they may have trouble falling asleep or staying asleep. Some also suffer from the condition sleep apnea. The reasons for the non-restorative sleep and other sleep difficulties of fibromyalgia are also unknown. Gastrointestinal complaints are very frequent in fibromyalgia. Digestive disturbances, abdominal pain, and bloating are quite common in fibromyalgia, as are constipation and or diarrhea, also known as irritable bowel syndrome, or IBS. Of course, there are many more unique and varied symptoms that are commonly seen in patients with fibromyalgia, but because the causes of fibromyalgia are not clear and no cure exists, the goal of treating fibromyalgia is to control the symptoms and minimize the discomfort. So if you continue to have one or more of these symptoms on an ongoing basis, it is critical that you consult your healthcare professional for an assessment and accurate diagnosis in navigating beyond medicine and exploring a new way of thinking about fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my fibromyalgia roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.